Good evening, and welcome to another edition of the Rankin Mon Valley Pittsburgh section of the National Council of Negro Women. My name is Pat Bluette, and I am the section corresponding secretary. And joining me tonight is Lorraine Penn, who is the section parliamentarian. We thank all of you who have participated in our previous program, and we hope you will join us again today by calling 412 953 9583. That number will remain on the screen. So if you need to give us a call, just look on the screen. Our special guest tonight is Dr. Tracy Conte, who will help us to discuss the COVID-19 virus and the vaccination.
Affecting African American women and their families, as well as promoting healthy lifestyles and behaviors through wellness projects. It also satisfies one of our four For the Future initiatives, which is to continue NCNW's historical focus on health concerns in the African American community. We will introduce our special guest today by reading her brief bio. Tracy Conte, MD, is Executive Vice Chair of Family Medicine at the University of Pittsburgh School of Medicine, Program Director of the Family Medicine Residency Program at UPMC McKeesport, a practicing family medicine physician and one of the region's leading voices in health disparities. She has been a strong advocate for her patients and as a member of the Black Equity Coalition and president of the Pennsylvania Academic of Family Physicians, she has been one of the leading voices on health disparities in the state. Welcome, Dr. Conte. We thank you for appearing on our program this evening and would like to begin with a few questions.
Well, thank you so much for having me. I'm excited to be here and to discuss the COVID-19 pandemic and everyone's questions.
Thank you. Our first question, because there is so much different information coming from the CDC, the WHO, and the hospitals, could that be why people are listening to misinformation?
So, this is what we call a novel virus. It means it's new. And anytime there's new information, it becomes confusing as new things change. And over time, we will know more about this virus and we continue to learn every day. And so because this virus is so deadly, a lot of our organizations like the CDC, like hospitals, are trying to get as much information out as quickly as possible when they know it to the public. I think the misinformation comes from a lot of skepticism about this virus. And unfortunately, politics, this virus had a lot to do with politics in our country. And we were divided when this virus came, and people are listening to, sources that don't come from trusted information. I think that there's also a history in our country, especially around Black bodies, and a source of mistrust based on things that are very real and the atrocities that have previously happened that cause us to be mistrustful, like Henrietta Lacks, like Tuskegee. I think where this is different is that there are physicians, epidemiologists, researchers that look like you and me that are involved and are making sure that the safety mechanisms around the information that goes out for COVID-19 is reliable. It's just up to us to make sure we're listening to trusted sources. I gave an example of I was recently, rounding in the hospital, and I spent, a lot of time talking to a patient, and I said, well, I'm just going to go check the internet. The problem with the internet is anybody can put anything on the internet. It doesn't matter if it's factual or not. And people choose internet information based on the likes. Well, oftentimes the most unfactual things get the most likes, and that's what pops up first. And so it's so important for us to make sure that we have trusted resources, community members that we can go to and really find out what's true and what's not, to ensure that, and programs like this that will deliver the truth and get that message out to people.
Okay, thank you. And from my understanding, COVID-19 was also called SARS-2. When SARS-1 was present in the world, how come we weren't advised to wear masks and take a vaccination at that time?
So SARS-1 is a different virus. If you think about the family of coronaviruses, there are over 100 different types of coronaviruses. As new viruses become what we call pathogenic, meaning it infects us, there are different pathologies. And so SARS-CoV-1 was extremely, virulent and caused people to get sick. However, it wasn't causing people the same death rate. And so those patients that did have SARS-CoV-1, they did have, treatments that they were providing to them, but it didn't reach to the levels that everybody was vaccinated. And actually, that's where the research for the SARS-CoV-2 vaccine came from, because they were already researching how can we protect ourselves against different coronaviruses. And SARS-CoV-1 actually gave the baseline for this SARS-CoV-2 vaccination. And that's part of the reason why the vaccinations were able to be manufactured so quickly, because they are already started on the types of research to help prevent this vaccine, to prevent this virus. The differences really between SARS-CoV-1 and SARS-CoV-2, or the COVID-19, is the deadliness of it. This vaccine is killing people at a higher rate, and it's much more what we call pathogenic than that SARS-CoV-1.
Okay, great, thank you. The last part of this we had talked about, but I'm going to substitute what we talked about before: the smaller size swab versus a larger one. Which one would give the best results, and how come that's not being used more often?
Yeah. So, the deep nasal swabs are probably your most accurate. Those are very expensive, and not everybody has them, and they were harder to manufacture. When you think about how we test for things, we're trying to find the most efficient as well as inexpensive test that does the job at the point that it allows more people. One of the difficulties with this virus is that the best test was not able to be manufactured at the same rate, and therefore did not have a lot of that testing material. And it also, from a resource standpoint, takes a lot of manual resource to have everybody tested that way. And so if you want to get a quicker test to get a better sense of where virus is and how much virus, you have to utilize testing that the majority of people can do. It's very similar to, some of the self-tests that they sell in stores, right? You can buy tests that will test your cholesterol. Is it the same as the test that if you go to a lab and have your blood drawn? No, but it gives you a good picture, and it allows more people to be tested, and allows us to have more information so that we can know where to focus our targets at.
Thank you. Thank you very much.
Okay. All right, I'm going to ask the next question, Dr. Conti. Now, this has several parts to it, too, so I'm going to read the whole question in its entirety, and then you can give us your answer at that time. This is, what information can you share with us about Delta variants? What are the symptoms? Who is most likely to be affected by this variant? Is it more deadly than the original COVID-19, or is it more contagious?
That's a really good question, and thank you for that. And as so many people are talking about the Delta variant, but I want to go back to just viruses. So viruses are, particles that can infect us. Right? The whole goal of a virus is for it to live. When we find a virus that, whether that be an HPV virus or an HIV virus or a common cold virus or the COVID virus, that virus wants to survive. And so anytime there's a treatment for that virus, the virus is continuing to want to keep itself active. Viruses are very smart. They know how to change, and that's what happens. Viruses mutate so that they can infect more people, because that's what viruses do. And so the best thing that we can do from a population standpoint is to decrease the amount of virus that's out there, because the less viruses there is, the less chance it has of mutating. The more virus that's around, it is going to mutate because it wants to continue on, it wants to live. So there are multiple different mutations. The current mutation that we're dealing with now is the Delta virus. And again, because this virus is trying to survive, the Delta mutation is a more potent COVID-19 variant. It means that it infects people quicker, which means it's more contagious, and it actually is more deadly. So you asked who is getting the Delta virus, the Delta variant virus. When we initially saw Delta, it was really the disease of the unvaccinated. Those patients that did not have a vaccine, that's who the Delta variant was infecting. What we are seeing now is that there are some cases of vaccinated patients that do get breakthrough infections. However, what we do know is that if you're vaccinated, there is less likely that you're going to have that serious reactions such as death or hospitalization from Delta. And so again, it's so important for us to continue to get vaccinated, because even now there are more virus variants that are coming out. And the longer that we leave lots of COVID-19 virus out there, the more chance it's going to mutate, and each strain tends to get deadlier.
Okay. Lori, I'm going to let you go with your next question, because you pretty much answered the next one I have.
Okay, thank you. What are the treatments? Why are the treatments for COVID-19 different for each patient?
Yeah, so treatments are based on symptoms. And again, as I said before, this is a novel virus. And so we are trying to, we are all in this study experiment about how we're treating this virus and what are the things that work. Right. When COVID-19 first started hospitalizing people, we were using our traditional treatments for patients and recognized that that was not going to work for this type of virus. And so different hospitals utilizing different things, studying them against different patients, came out with different recommendations. And so depending on the severity of disease that you may have, depends on the treatment that you get. So one of the treatments that can be broadly available for patients, especially if you're COVID positive and you don't have symptoms, is the monoclonal antibody treatments. They call those Regeneron. That's the shot that, our previous president got when he got COVID. What that is they pulled patients that had COVID and utilized their antibodies. So the antibodies that we have in our bodies that fight against virus, they took those antibodies to make kind of a super antibody treatment for people exposed to COVID, so it can wipe out the COVID virus immediately. The reason why that's utilized in patients that really aren't sick is because that's where it works best. Once you start to get really sick, the virus is so much in your body that given you extra antibodies just isn't going to work anymore. And so, thinking about how we treat COVID from a symptom standpoint, we know that it majorly affects the lungs. It causes fluid in the lungs. And so positioning patients different ways to try to prevent the lungs from collapsing, to keep them as open as possible, is one of the treatments. Oxygen, which helps maintain perfusion of the tissue and the rest of your body as one of the treatments. There are certain medications, antiviral medications that they have studied that have worked. However, depending on where your symptoms are and what you may or may not be eligible for those antibody treatments. The best treatment, though, for COVID is not to get it. And so how do we not get COVID? It's by being vaccinated. It's by, wearing masks, and it's by washing our hands and staying socially distant when possible.
Okay.
Thank you.
Okay, now the next question is the news headline: to wear a mask, not to wear a mask. So, why is there such a controversy about wearing masks? Or do you think it's totally political? And are the masks effective?
Yeah, this is a conundrum to me because we've been wearing masks and using personal protective, devices through all of my medical career, right? If you think about some of the earlier tools that we had to decrease disease is washing our hands and wearing a mask. And it's become so controversial because of political alliances and, people feeling like they're being forced to do something. So first, what masks do? So masks are really me doing my part to protect you, right? If I am coughing, in order for my respiratory droplets not to get out to you, it makes sense for me to wear a mask to prevent that. If everybody said, I want to help my fellow human being, I'm going to wear this mask so that I can protect you. And then, so by you wearing a mask, you're protecting me. So we're in this mutual fellowship of people of helping each other. So do masks work? Yes, they work very well. And actually, last year was great evidence for how well masks work because we didn't see flu. We had virtually no flu because everybody was wearing masks for COVID. And masks wearing are not new. If you look at some parts of Asia, that was a common practice that if they were sick, they would wear a mask, and it was really to protect their fellow people. And so we have been, physicians have been wearing masks for ages without any side effects. They work very well. I think there's some controversy because there's some literature out there that say masks don't work well against aerosolized COVID. And that's absolutely right. But aerosolized COVID only comes from certain activities, like if we are doing a nebulizer treatment like we use for asthma or COPD that creates small aerosolized COVID. Well, yeah, the regular cloth masks don't work for that. But when we're just walking around, no one has aerosolized COVID. We have COVID that's from respiratory droplets, and that's just regular saliva, regular coughing. And masks are very, very effective against that. And we saw that it worked. We saw it last year. I think we're at a point of fatigue, and people are tired, but masking is the right thing to do.
Thank you. Now, there are people concerned about the carbon dioxide levels increasing in people wearing masks for long periods of time. Also, does it increase the chance of bacterial pneumonia? What is being said about that?
Yeah, so those are some of the myths of mask wearing. When you think about surgeons who are in transplant operations that have masks on, they can have masks on for up to 12 hours. Never did they have a decrease in their oxygen or an increase in carbon dioxide. And so that is just a myth that's out there. It does not increase your carbon dioxide. You get plenty of oxygen. If your mask gets wet, you should put on another mask because, again, it is not not going to work as well as a dry mask. And so if you think about some of the sports teams that are out there wearing masks, when their masks get dirty or wet, they change them. It's the same thing that we would do if we were in the operating room and our mask got dirty or wet, we would change it.
Thank you. When exercising in gyms with masks and they get wet, you just ask it, does it make it easier to spread the virus? And how often should you change your mask? You kind of covered most of it, but
Yeah. I mean, and that's just with anything. It's the same with washing your hands. Just because you wash your hands doesn't mean that you only wash them once a day. If they get dirty, you're going to wash your hands again. And so, if you have a mask on and say you do get it wet or it tears or becomes damaged, well, it's not going to be as effective as a mask that's not torn or it's not wet or it's not dirty. And so you have to use your best judgment to say, okay, this mask needs to be replaced. It's time for, if you have a cloth mask, time for to wash it and get a new one. And if you have, a paper mask, for you to throw it away and utilize another one.
thank you.
Okay, thank you. Okay, we have Pfizer, we have Moderna, and we have Johnson & Johnson. Why don't they just manufacture the one vaccination that has the highest efficiency? And are there other vaccinations out there?
Yeah, a really good question. And we covered this a little bit earlier. Companies and researchers research what they think is best, and there's no mandate to do it one way. And that's how we have, discovery, right? If everybody studied the same thing the exact same way, we could miss treatments or miss opportunities. And so these viruses started out based on research that was previously done, and most researchers just continued their vaccine. So, we'll break it down a little bit. The types of vaccines that we're talking about, the mRNA vaccines. So how those work is they contain just some small material from the COVID-19 virus. And what that material does is when it's injected into us, it tells our cells, it gives it instructions of how to make a protein that is unique to fighting the COVID-19 virus, right? And so after our cells start to make copies of that protein, it actually destroys that mRNA, right? So the mRNA doesn't stay in your system. And, part of the reason why it has to be stored at such a cold temperature, because it's very easy to destroy. And so once, it does not stay in your body forever. But what does stay is that body recognizes the proteins that shouldn't be there, right? And then they start building antibodies. So our cells that fight off infections, so that when they can stop infections in the future. So if you're exposed to COVID-19, it's going to recognize that as foreign and fight it so that you don't get sick. Then you have vector vaccine. So the Pfizer and the Moderna mRNA and vector vaccine, that's what the Johnson & Johnson is. And it works similar, but what it does is it contains a modified, so a slightly different version of the virus than the one that causes COVID-19. And inside that slightly different version of the virus, there is material from the COVID-19 virus, and we call that a viral vector. And so once that gets into your body and inside your cells, the genetic material it makes a protein that looks like COVID-19. And so then your cells, they start making copies of those protein, and that is what causes your body to make those fighting cells so that will remember how to fight off that virus if you're infected in the future. Whenever there are multiple ways to make a vaccine or to come up with a new treatment, in order for us to get the best, you're going to have different things. And so no one is ever going to tell a company to only make something one way, because that we would lose our ability to make the best things if everybody did it the same. And so you want to make sure that you're always trying to find better methods, and you keep finding better methods. And while we have those 3 vaccines here in the US, in other parts of the country with different manufacturers, they have different vaccines that, work similarly, but they are different from the ones we have here.
Okay. All right, thank you. And you pretty much answered the next couple of questions with your answer just now. So I was just going to go to the next one, Lori. It says, can a vaccinated person spread COVID-19?
Yeah, that's a really good question, especially with this Delta variant. And so what we know is that if you're vaccinated, you have a very small chance of becoming infected with COVID-19, but it's not zero, right? What the vaccines do is they prevent serious illness and death. And so that means decreased hospitalizations, decreased intubations, and decreased death. There is no vaccine that's 100%. Our flu vaccines are not 100%. Actually, our flu vaccines are only about 50%. And the COVID vaccines are much, much more effective than that. Our, childhood vaccines aren't 100%. So you will, as vaccinated people, have some risk, which is why if you are in a place that has a lot of unvaccinated people and a high amount of COVID, you should do whatever you can to protect yourself from getting infected. And that means wearing masks, washing your hands, social distancing. And so because there is always that small possibility that if you're vaccinated, you can get the virus. If you get the virus, you can therefore spread it to people. And so it's why we tell our families, even if they are vaccinated and they have small children that are not vaccinated, that they should avoid those risky areas that could potentially give them the virus that they could take home to their unvaccinated children.
Okay.
Thank you. One of the questions that we skipped over, what is the worst reaction to mRNA?
Yeah, and so mRNA is just a way that your body recognizes that foreign substance called the vaccine. And so with any vaccine that you get, your body is going to react. And so what we have seen, and are the same side effects that you have with any virus. So arm soreness is the most common one. Your body is creating antibodies to fight off infection. And so there's an inflammatory response that happens. And where the biggest concentration of that inflammatory response is at the site of the injection. So it just makes sense that you're going to be a little bit more sore. Okay. Everybody responds differently. And if you remember, if anybody who has children, or when you were a child and you got vaccines, a lot of time you had to get Tylenol after, because you could get a fever. That's your body reacting, right? And so no different with adult vaccines, you can get a fever. Some people get viral-like symptoms. They're not getting a virus, but they're getting viral-like symptoms. So fatigue, body aches, chills. They don't have the virus. What they're feeling is their body fighting against this foreign. It's giving you the same response, right? Most of the time when you get a virus, it's not the virus that's making you feel bad. It's your body's response to fighting that virus that doesn't make you feel bad. You're doing that same reaction as you get the vaccination.
Okay. Now, does the vaccine change your DNA?
Right. And that's a common myth. It does not. As I said, that mRNA is very, very unstable, and mRNA has nothing to do with DNA. But even that mRNA sequence actually goes away very quickly in your body because it's not stable enough to last in your body for any length of time.
Okay. Will we have to get the vaccination every year? And how about the booster shot?
So, those are some of the things that we are still learning. Again, this is a novel virus, which means that we are learning as we go. And so the things that we are still learning is, how long are the COVID-19 vaccines going to protect people? We have some good data, right? It's looking between about 8 months, and we're trying to see if that could be a year. What we also don't know is, how many people have to be vaccinated before we can say that we have that level of herd immunity. For most viruses, you need about 75 to 85% of people to be vaccinated before that happens. We know that that's not where our levels are, and we know that we're not at that kind of herd immunity. And what we're also learning is how effective are these vaccines against the new variants that cause COVID-19. So for Delta, we know that these vaccines are pretty effective against the Delta variant. Part of the reason we know that is because these vaccines were studied in other countries that already had the Delta variant there, and we have the research saying that they do well. What we don't know is when other variants come, how well our vaccines will protect us. And so we continue to learn, and it's no different than any other vaccine. We're constantly studying our vaccines and vaccine effectiveness. The story I like to give is about, whooping cough. When you were younger, you got a protection against the whooping cough, and it's called pertussis vaccine. And you usually got that along with your tetanus vaccine. And in children, they were Tdap. And then as you became an adult, you no longer got vaccinated against whooping cough. You really just got the tetanus boosters, the vaccinated against tetanus. Well, then they started seeing adults getting whooping cough. And so now, after we've taken some time to learn about that many, many years later, adults get booster shots against the whooping cough. And so we recommend that adults get the Tdap, which is a different version of the DTaP. So no different than what we will learn about COVID vaccine as we continue to go on and know more about it. And so we are constantly learning. We're constantly looking to see what recommendations are out there for us to make.
Hey, Dr. Conti, we have Jim who has called in to ask you a question. Good evening, Jim. How are you?
Oh, fine. Thank you. I'm enjoying the show, by the way.
Oh, thank you.
I just have two questions, and then I want to hang up and listen to the response. Which one of the vaccine shots is the most popular, J&J, Moderna, or Pfizer? And I also heard a doctor not long ago say if everyone wore a mask for 2 to 3 weeks in the United States, the virus would basically disappear. I want to know, do you agree with that? I'm going to hang up and listen.
Thank you, Jim.
All right. Well, thank you for that question, Jim. We'll talk about the first one. We know that all the vaccines are effective, and that's why they are out there and were able to be used. Right now, the only vaccine that has FDA approval is the Pfizer vaccine. And so what we have seen in the medical community is once that vaccine had FDA approval, we saw more people asking for it. So I don't want to say it's more popular. I would say that is the one currently that more people are asking for. But I just want to caution us in knowing that every vaccine is effective and you have to make the right choice for you. It depends on availability and what you can get. My point is, doesn't matter what vaccine, just get vaccinated. And so, it's an interesting thought to say if everybody wore masks, would we see an elimination of COVID? masking would help us tremendously, but it's masking along with vaccination. That those are going to be the two best ways to move forward with this disease. If you think about where we were, a year ago, at this time, everybody was starting to wear masks. And it wasn't until we saw vaccinations that we really saw that decrease in the number of patients that were infected. And so it really takes both methods, and washing hands too. You never want to forget about that.
Okay. Lori, do you want to go on with your question?
Should everyone receive the booster shot, and will the booster shot prevent you from getting the virus?
Yeah, so it's still, we don't know right now if everybody should get the booster shot. What we do know is those with immunosuppression. So if you have AIDS, if you have certain cancers, if you have certain rheumatological disease, it puts you at an immunosuppressed state. We have researched those patients and they don't mount that same immune response that we talked about. So they're not going to have the same amount of antibodies to fight COVID. And that's why those individuals are able to have that booster shot. If you're unsure, if you're in that category, talk to your doctor. There is a list, a standard list that they can look at to see if you are eligible. Your insurance agency can also help you. They have lists of who is eligible for that third booster shot, and many of them are proactively reaching out to their members and saying, you're eligible for the booster shot, you should get them.
Thank you.
I think that we will know in the next couple of months when they're going to recommend the general public to get a booster shot and for how often. I've heard anywhere from 8 months to 12 months, and the recommendations just aren't available yet.
Thank you. Now, should pregnant women receive the vaccine, and what effect could that have on the baby? And then I have a second part. Okay, the second part also.
So
Go ahead.
no, I was going to say yes. We have good research that says pregnant women should get the vaccine. They actually protect their child against the vaccine. We've recommended flu shots for pregnant women for the same reason, that it does protect their babies. Their babies, antibodies get passed on from moms to babies. And we know that if moms have a good antibody response, their baby is going to have that good antibody response to respond to that COVID exposure.
Great. Now, also, what happens if you have COVID when you get the vaccine but don't know you have it? Why don't they test you first?
Yeah, so the majority of people don't have COVID when they get the vaccine. And so what can happen? Because you already have that virus and your body recognizes it as foreign, you may have a stronger response to the vaccine. Your body may have a stronger response. So that means you may be more sore, you may get a fever, you may get those chills. Our goal is to get people vaccinated, and that is hard enough. When you add on the testing requirement to vaccination, you're going to decrease the amount of people that are going to get vaccinated. And, it is not a contraindication necessarily to have COVID when you get the vaccine. It just means that you may get, feel worse. And so that's why we're recommending just do the vaccine. Now, if you have been exposed to COVID, you should get tested just as in general so that because then you have the availability for the treatments that are out there. And so if you have any reason to think that you were exposed, go get tested so that you can get treated. And then they'll give you guidance if you are COVID positive about when you can get the vaccine.
Thank you.
Well, that's part of my next question. This is, if you already had COVID-19, do you have to get vaccinated? And then it says, how long should you wait before getting the vaccination?
Yeah, so you should absolutely be vaccinated if you, even if you had COVID. So what we know is that you do mount that response, and you do get a higher antibody response if you had the COVID vaccine. If you had the COVID infection, but that response doesn't last forever. And most patients' responses to having COVID infection, those antibodies are gone between 3 to 6 months. And so that's why they recommend that you still get the vaccine even if you had COVID, because that response, your natural immunity doesn't last as long as we once thought it did.
Okay. And we hear that natural immunity is better than vaccination. Can you elaborate on that?
So with natural immunity, you get that initial higher antibody response. And so while that in that immediate state does protect you, it doesn't last as long. And also, you do not want to take the risk of getting COVID-19, because you can die, you can be hospitalized, you can be intubated. There is no guarantee, even if you are a healthy individual, by getting yourself exposed to get COVID naturally, that you're going to have a good outcome. We know that getting that vaccination is not going to get you sick. It's not going to get you hospitalized.
Okay.
Do we have a target date for when children under 12 years of age can be vaccinated?
Yeah, so no one wants to say this date, and I hear that it's going to come out soon. In the medical community, we are thinking that they're going to approve something by November. That's hopeful. I think we can safely say that by January we'll know for sure when. What we don't know is exactly how old the vaccine recommendations will go down to. It's thought that it will go down to the age of 3, and so then anybody 3 and up will be able to be vaccinated. We just don't have that guideline yet, but we're hopeful that it will come out soon. A lot of us wanted it before the school year. We were hopeful, and it just didn't happen.
Since children under 12 have not received the vaccination, how can we keep the elementary age students and teachers safe in schools?
Yeah, so one is by having the teachers vaccinated, and it's by masking. And I know there's been such a controversy about these masks, and you look across, the country, and there's fighting and arguments. But you look at those school districts that went back without masking, you look at the amount of children and adults that had to be isolated and got serious disease because of that. We have now had confirmed cases of teachers dying. We've had children that, have been seriously ill and that were healthy. And if all it takes is for us during the school day to wear a mask, it is well worth whatever inconvenience people feel. It is not about stepping on rights. It is not about, somebody's body choice. It's about keeping your children safe. It's about keeping those around you safe. It worked last year. There were school districts able to be in school all year because they were masking. And so we should do whatever we can to keep our children safe, and that includes masking.
Okay. Now that the flu season is upon us, what should we expect?
I think it all depends on masking. I really do. I mean, the example, as I said earlier, was last year we didn't see flu, and we didn't see it because people were masked. You get flu the same way that you get COVID, even though they are different viruses. They are spread through coughing, sneezing. And so if I wear a mask, if I cough and sneeze, it's going to decrease the amount of virus that could potentially get that's out in the atmosphere. What we do know, and when we first start giving vaccines, we talked about having to separate the COVID vaccine from other vaccinations. They've studied that, and you can get the flu and the COVID vaccine at the same time. And so our hope is that people will continue to get immunized against the flu, and those that are not immunized against COVID will get COVID and the flu vaccines to help protect us all.
Okay.
Thank you. Well, that answered one of my questions. This one is, for those who are afraid they may have adverse reactions to the vaccination, how are the doctors prepared for what may occur? And how long does it take for those reactions to show themselves? Reactions such as myocarditis, enlarging of the heart, Guillain-Barré syndrome, GBS, when your body's immune system attacks your nerves, blood clots, anaphylaxis, a severe, potentially life-threatening allergic reaction.
Yeah. And so all of those reactions occur because of how the immune system works. So one, anytime we're giving vaccines, we make patients wait so we can see if they're going to have a reaction. And that's with any vaccine that you give. We should be watching our patients to make sure that they don't have a reaction. We have medications available to be able to counteract an allergic reaction to a vaccine. And we also ask screening questions. And so we check to see if you were allergic to other vaccines, if you were allergic to different components of the vaccines, and if you've had a history of those things like Guillain-Barré. We know the majority of people don't have that reaction. And so it's important for us to not overestimate the number of people that have bad reactions. The more common reactions, those are things that we should always talk to our patients about, and how you can help with those common reactions. I can give you my own story. When I got my first vaccine, felt fine. I was great. And I got the Pfizer shot. My second vaccination, I actually had chills and rigors. And even as a physician, and you think you know, you never really know until it happens to you. And so I was sitting shaking in my bed saying, okay, this is what rigors feel like. No wonder our patients don't like this, because it felt terrible. But I was able to drink lots of fluids. I took some Tylenol, and a couple of hours later, I was okay. And so utilizing, the stories that we hear from a majority of people, utilizing the standard things that we do for normal vaccinations and vaccination side effects is what's going to help us. I don't want to negate those anaphylactic reactions, because they do occur, but they occur in such a small minority of people, and we are prepared for those. We at UP, I work for UPMC Health System, and we do a lot of community vaccinations. We always have emergency medical personnel on site, just in case. In all of the vaccines that we've given in those community events, we haven't had anybody have a negative reaction. So that's a great thing, and it's very reassuring.
Right.
Thank you.
Lori, we're getting to almost the end of our program, so we need to look through and find out what questions that we want to eliminate, and just ask the ones that we think we can get answers for today. So I'm going to move on to the one: how can we build our immune system against COVID-19? Can we use medication, exercise, diet, healthy weight, good sleep? What do you suggest?
All right. So, in order for us to just be a healthy people, we should be doing that stuff anyway. We need to watch what we eat. We need to exercise, and we need to eat healthy. That will build our immune systems in general, but it is not going to build our immune systems against COVID-19 specifically. And the only way to build your immune system against a specific virus is either through getting an infection, which we don't want anybody to get, or getting vaccinated. The things like, vitamin C, different, healthy shakes. Those are all good things, but they're not going to fight COVID-19. And what I don't want is for people to have that and try to utilize vaccination or vitamin concoctions that really have not been proven are work, because you're decreasing your ability to get some of the treatments that we do know that work, and you're increasing your risk of getting sicker. But we should all be living healthy lives. That's the whole purpose of well-being, is by eating right. It's by exercising, regardless of what viruses are out there.
Okay. I have a question. Um, what are the reported lasting after effects of the COVID-19 that have been reported? For instance, does COVID-19 cause weight loss? When testing for COVID-19, why don't they always, no, so I said, we don't have to deal with that one. You answered that one, but what are the lasting after effects of COVID that have been reported? For instance, does it cause weight loss or anything like that?
Yeah. So there are a lot of patients with what we call that are long haulers with COVID, and we are still, looking at what that long hauler syndrome is. The number one complaint is the fatigue associated with it, and people just don't have the same stamina or energy than they did pre-COVID. The second one is what they call kind of a COVID fog, where their mind just doesn't function the same. They're kind of in a foggy state, and it can sometimes interfere with their memory, or it takes a little bit longer for them to remember things. And then, the chronic cough is another big one. There are some patients who have had COVID, and they still have coughs, even though it's been 8 or 9 months since their COVID infection. What we don't know is, even in long term, what do these COVID infections mean? So 5 and 6 years out, what are our patients going to have? And again, those are some of the questions of the things that we are still learning, the things that we still have to see of what this disease is going to do to our community.
Thank you.
Okay. I'm going to skip down to a question. It is to you and others in the medical field. As doctors and medical people, how does seeing so many patients die from COVID-19 affect you on a human level?
That's such a great question. And it's not just the medical community. I think it's our community as a whole. And what does a pandemic that causes so much suffering and death do to a community? And it becomes hard, right? It is hard to know that patients are getting sick, and you can try all of your best treatments and they're not working. I think at this point, it's hard because we know that it's mostly preventable. If we can get people vaccinated, we do not have to continue to see the death and dying. We don't have to continue to see these high rates of hospitalization. And I think for all of us, not doing the normal things that we are doing, we're having this online versus in person, and that, that lack of that increased social isolation and vulnerability becomes really difficult. And so making sure that as a community that we support each other, I utilize my faith. My husband is a pastor, and prayer works. And when we're human, so you get down. But I think the frustration that some of us see when we know that there's a treatment out there that works, and it's vaccination, and people are doing everything but what works. It can be very, very difficult to work through.
Okay.
How can you check to see if you have the antibiotics for COVID, and what is herd immunity, and what will happen when and if we reach it?
Yeah. So there is a blood test that you can get to see your levels of antibodies. it's not the best test. It doesn't necessarily tell us, well, at this level, that's when you can go ahead and get COVID again. We just don't have that information. But if you were really curious, you could ask about a blood test. I'm sorry, can you repeat the second part of the question?
What is herd immunity and what will happen when and if we reach it?
Right. So herd immunity is that population immunity where most of the people have the antibodies that fight a virus. And so therefore that virus doesn't have the ability to infect a lot of people. So even if you are not immunized, because there's decreased amounts of the virus out there, the other people protect you. The issue with herd immunity is it's not forever, right? At any time that herd immunity drops, so that means the more people you get into your circle that aren't vaccinated, it decreases it and it puts everybody at risk again. We see that with the measles, mumps, and rubella. We hadn't seen measles for a long time. And then the more people that started not getting that measles vaccination, we saw that, people were getting it. Previously, they were protected against herd immunity, but there's a certain point that you kind of have to keep most people vaccinated in order to decrease that virus from being present in the community.
Thank you.
Thank you. Are there any updates or other information that you would like to share with us on COVID-19 and getting vaccinated?
Yeah, so, I think when vaccines first came out, there was such a hard time for people to find out where you could get vaccinated and have access. We have essentially solved that. There are places right across the street from you, wherever you live, that's within your neighborhood that you can get vaccinated. They're going to be at your physician's office. Our federally qualified health centers that we have in the community all have access to vaccine. Some of our churches are doing vaccine clinics. And so that the ability to find some place to get vaccinated is very, very easy to do. And so I want to make sure that everybody knows that vaccine is available. But I also want to make sure they know that unfortunately, if you're in that circumstance that you get COVID, that there are early treatments that are available to you. So please don't stay home and isolate yourself. Call your doctor, tell them, I have COVID. I heard that there are treatments that I can take to prevent me from getting really sick. And your doctors can help you.
Thank you.
Thank you so much. So at this time, we're winding down. We have 3 minutes left. Is there any imparting information you'd like to leave with us, Dr. Conti?
Yeah, first, let me just say thank you so much for having me on your show today and to be able to get this knowledge out to people. So I applaud you all in your organization for doing that and being a trusted resource. And I just want to, don't turn to the internet for your information on this disease because there's so much out there. Talk to your physician. If you don't have a physician, talk to your clergy, talk to somebody trusted that can get you to the right place and the right source. I know on the screen they had a website, you can always go to the cdc.gov to get published trusted information, and that can be a starting point for you to go to your physician and say, hey, I read this, I need to know if it's true. But please talk to a trusted resource. Don't just believe everything out there on the internet because anybody can put something out there.
Yes, thank you.
Well, thank you. We would like to thank you so much for taking the time out of your busy schedule to inform our viewing audience about the latest information on COVID-19 virus and the vaccination. We also thank all of you for tuning in. And remember, our live program airs the first Friday of every month at 6 p.m. Remember to get out and vote and get vaccinated.
Wash your hands.
And
wear a mask.
Wear your mask. Wear your mask.
Right.
Thank you, Dr. Conti.
Thank you.
Thank you.